green color, akhdar. Can you see that? Factor 10 and factor 7 maktoob here. Before that, there are two pathways, separate pathways. One is coming from the extrinsic and one is coming from the intrinsic. Which one is a tawil pathway? Intrinsic pathway or extrinsic pathway? Definitely, intrinsic pathway has more steps. It's more complicated. Can you see that? Isn't it? So, let's talk about the extrinsic pathway first. Okay, starting from the right side. Extrinsic pathway. Okay. Now you see, in the extrinsic pathway, the first thing which will happen is the tissue injury. Okay, the tissues are injured. When there is a tissue injury, which factor is released from the tissues? Factor, khalas. What is maktoob there? TF. Can you see the word TF? TF is module. Okay, so TF is released. TF is the tissue factor. Everybody sees that? Okay. Now, what will happen? This TF is like an enzyme. Okay, it will activate factor number 7. Okay, this is factor number 7 to 7A. Why am I writing A, small a? Active form. Just to make a difference between inactive and active factor. If I am writing factor 7A, it means yani factor 7 is activated now. Do you see that? Yes. So tissue factor is released. Tissue factor will work on factor number 7 and it will activate it very quickly. Khalas. This step is over and factor 7 is now ready. 7A is now ready. Okay? Now, factor 7A, do you see that? Now will make a complex. It needs calcium ion. Can you see the calcium ion? Can you see that tissue factor is attached with factor 7A and calcium ion is also attached with factor 7A and tissue factor. Alright? Do you see that? They will form a complex. Okay? It's a complex of three things which are formed. Calcium, factor 7A and tissue factor. They are combined. They form a powerful complex. Okay? This complex is formed and this pathway is now ready. Alright. This complex will activate factor number 10 to factor number 10A. Do you see that? This complex, factor 7A, tissue factor, calcium, along with three things, it will now act on factor number 10 and it will convert factor number 10 to active factor number 10. Okay? Factor 10A. This is activated. This pathway is khalas. This pathway is finished. Only two steps were modules in this pathway. So this pathway was very simple. Okay? But now you see this pathway, intrinsic pathway, which is a little tawil, isn't it? It has more steps. Let's start this pathway from top. When the blood comes in contact with this pathway, remember, is intravascular pathway. Okay? Normally inside the body it is intravascular pathway. Outside the body it's extravascular, but it's vitro. Okay? And vitro, when it comes in contact with glass or any smooth surface, then this pathway will start. Okay? So the first point is the contact with the glass or contact with any surface. When the blood comes in contact with any surface, then this pathway starts. This pathway has factor number 12. The starting point is factor number 12, please. The story starts from factor number 12. 12 is activated to 12A. What is activating it? Number 1, contact with the glass surface or contact with any surface. And we also need a little thing. Remember the clotting factors, Jadid clotting factors in the list after there was written pre-kallikrein, PK. PK was maktoob. PK is also needed. So, factor 12 is activated to factor number 12A. Khalas, this is the step out. Step out of the part. Now, once factor 12 is activated, it will activate factor number 12. It's an enzyme now. It will activate 11 to 11A. But you also need one little thing, one more factor. And that is HMWK. This is also module in the list if you see. HMWK is also module. Yes. Okay? Alright, factor number 11 is formed. So 12 is activating 11. Okay? and now 11 is ready, 11 is active. You will think that now 11 should activate number 9. No, normally if 12 is 11, then in our mind it will come 10 with 30. No, it's not like that. Originally, factor number 12 is activating 11 and 11 will activate 9. Okay? Not 10, 9, please. Be careful. Factor number 9 is activated. Calcium is needed. Factor number 9A, active form is formed. Khalas, no problem. Till now, we have formed factor number 9. Factor number 9, okay, now will also receive one more factor. Factor number 8 is also needed. So factor number 8 is activated by a little amount of thrombin which comes in the blood, little traces of thrombin, and that factor 8 is activated to number 8A. Now 9 is ready here and 8 is ready here. Both are now activated, okay, at the same time. 9 is active and 8 is active. Now they will form a bond and they will become one. They attach. 9A, 8A. Alright? This one. Calcium is also modular here. They are also forming a complex. Just like we formed the complex here. Remember we formed the complex here also. Just like that. Here also you are forming a complex. 9 and 8 active forms. Calcium. Okay. And this will also activate factor number 10. One pathway is intrinsic pathway coming, a real one. One pathway is a short pathway which is coming extrinsic. Yes, dear, your question.
So, do we have both complexes or one enough?
No. Actually, these are the, I am telling you about the imkan. If intrinsic pathway is working, this will happen. If extrinsic is working, it depends on the situation. That's
one enough.
One enough, yeah, one can do it. But the question is, normally, which pathway is controlling our mechanics of coagulation? Intrinsic? Extrinsic. It should be extrinsic pathway. When there is damage to the tissue and damage to the blood vessel, main pathway which is activated is extrinsic pathway, and that is the main pathway of coagulation normally. At that time, some intrinsic pathway is also included, that is also activated. It can help also, but the major pathway, the main one, or many scientists say that the only pathway which is working normally for us is the extrinsic pathway. Intrinsic pathway only in special situations. Alright, you got it? But this diagram is showing you both the pathways, that how both pathways are operating. Are you getting the point? All clear? Now, factor 10 is activated to factor number 10A. This activation can come from this pathway, this activation can come from this pathway. Okay? Normally, this pathway is working. Normally, in injury. Normally, extrinsic or intrinsic. Which one? Normally, this pathway is not working, right? You are saying no. Yeah, you are right. Normally, this pathway is not needed. Which pathway is needed? This one, extrinsic pathway. This pathway is taweel. This pathway is short. Which pathway will take longer time to start and longer time to finish? Definitely this pathway will take longer time and this pathway is a shorter. Okay? Now after that, from here, from this point, the remaining steps common pathway. Alright? Now factor 10 is converted into factor 10A. Now it's active. Everybody's clear? Once factor 10A is formed, okay? Factor 10A is a khususi enzyme. It's a very special enzyme. Okay? And this enzyme is called prothrombin activator. It has a special name. What do you call it? This enzyme is the active form of factor number 10 is called prothrombin activator. Okay? Why? Because it will act on the prothrombin and it will convert prothrombin into thrombin. Bas, that's why. Very simple reason. Okay? So now you see factor 10, 10A. Okay? Factor 10A, factor 5A, calcium, and all this complex, this complete complex, which has factor 10A, which also attaches factor 5A, which also attaches calcium, it becomes a special activator. And we have given it a special name, and we call it prothrombin activated. Alright? This works on prothrombin, and it will convert prothrombin into thrombin. Okay? This is prothrombin. Alright? This one, factor 10A is formed. Factor 10A will attach factor 5A and calcium also, and it will become prothrombin activated. This complex is
Prothrombin activator factor
10. 10A, 10 complex. Okay? It's not only factor 10A. Factor 10A is the main component, but it also attaches factor 5A, and it also attaches calcium. 5A calcium here, like this, and this becomes the prothrombin activator. Alright? This is prothrombin activator. This will convert prothrombin into thrombin, and thrombin is a very powerful enzyme now. It will convert fibrinogen into bus. Clotting is done. Now you only need one more step, and that is stabilization. Factor 13, Kalata. Remember? The 13 one. Okay? Fibrin threads are formed. Okay? And fibrin thread will get entangled and they will become strong, covalent bonds. Fibrin stabilizing factor is working and it will make the clot strong to us. Okay? That's the whole idea. Did you see the two pathways, how the two pathways are coming? Yes. And how the common pathway is formed? And how finally the fibrin is formed? Alright? Any problem in this one, this diagram? Anything which is not clear? Yes, please.
Do we have to memorize this pathway?
Oh, not really, not all the steps in the exam. Nobody asks you that you have to remember the tarteeb or you don't have to. You have to get the main idea that how the two pathways are coming, okay? And what is the main starting point of one pathway and what is the main starting point, but not all the steps. It's just like a metabolic cycle in which you have 10 steps or 20 steps. You don't have to memorize everything. Okay? Because the whole idea is that you should have the main concept that this pathway is starting from contact and starting from factor number 12. And this pathway is starting from the tissue factor, mainly, okay? And at the point of factor 10, it becomes the common pathway from here. Right? Yes, yes, sir. No, factor 8. Factor 8 is basically for the intrinsic pathway. It's basically for the intrinsic pathway. And as you can see here, it's working here in this one, intrinsic pathway. Okay? Factor 7 is the main one for the extrinsic pathway. Alright. Any other question about this one? Clear? Now, the same diagram. Shabab. Look at that. This is the same diagram again. You might ask, why again? We have done the intrinsic and extrinsic pathway. Now, why are we doing it again? Look at that. The same steps are now two. It's an easy way, the same thing. But why are we repeating it? Look at the colors, alwan, which are used here in the diagram. Can you see the red color? Yes. Factor number 12, factor number 11, factor number 9, factor number 10, and thrombin. 1, 2, 3, 4, 5, you are coming down. Why are we using this red color, please? Because these factors are sensitive to heparin. Heparin can block these factors. Heparin is an anticoagulant substance. Remember, heparin is a naturally modular anticoagulant, and we also give it from outside, injection. Heparin, okay, in diseases. Heparin can block these steps. If I ask you which factors are blocked by heparin, yes, you have to memorize that. This is important. Okay? Which factors are blocked by or inhibited by the heparin? Heparin is a drug. That's why you need to know it. So you can see, okay, I know factor number 12, activated form, 11, 9, 10, and thrombin. These are sensitive to. Okay? I think it's clear? Look at the other thing. Some of the factors are produced by the liver, and vitamin K is lazim for their production. Vitamin K dependent factors. This is also very important. So if there is vitamin K deficiency, if the maulud is born with vitamin K deficiency, or if a person has vitamin K deficiency, which factors will not be formed or modular in the clotting system? If vitamin K is not molecule, it is deficient, which factors will be affected?
9, 10, 11, 12.
Okay, 9, 10, 7, and prothrombin, which is number 2. Prothrombin is number 2. 2, 7, 9, 10. This is the tertib we remember for vitamin K dependent factors. 2, 7, 9, 10. 2, 7, 9, 10. 2, 7, 9, 10. This is for vitamin K dependent factors. Right? That's why the colors are shown here, so that you remember that. Are you clear about the diagram now? Nothing special. It's only showing you the colors so that you can see heparin factors, which are inhibited by heparin, and which factors are actually produced in the presence of vitamin K. Just a quick comparison between the intrinsic pathway and extrinsic pathway. We know about these pathways. They are very simple. Alright? Now, intrinsic pathway, Shabab. Now you know the meaning of intrinsic pathway. Read and say yes or no. All clotting factors are within the blood vessel, yes or no? Yes. For intrinsic pathway, lazim. Okay? Alright. Clotting process is slower because it's tawi, yes or no?
Yes.
True. More important in thrombosis.
Yes.
We all know that. Okay? One point is jadid, it is new for you. There is one test. If we want to check the intrinsic pathway in the lab, in Muqtadif, if you want to check that intrinsic pathway is working normally in this person or not person, we use a special test, and that test is called activated partial thromboplastin time, APTT. APTT, activated partial thromboplastin time. It's maktub here. You can see that activated partial thromboplastin time. If I say I am doing APTT for the patient, immediately which pathway will come in your mind?
Intrinsic.
Okay? You are checking the intrinsic pathway by this APTT test. Alright? Okay. Extrinsic pathway. Look at the characteristics of extrinsic pathway. Very easy. The blood has to go out, or the tissue factor has to come into the blood. Yes or no?
Yes.
Okay? Last. Clotting is faster or quicker.
Yes.
Because it's only 2 steps in the pathway. It's quick, isn't it? And it is the main pathway normally which is happening in all of us.
Yes.
Under normal healthy conditions when we have clotting. Which pathway is mainly working? Main pathway. It is the extrinsic pathway. We know that. Okay? The test which is used to check this one is called prothrombin time. Okay? Please don't forget that it is the most important information you will carry in the next lectures, that in this person there is a disease probably in the extrinsic pathway. So please order a test or please write a test. Which test will you use? It's prothrombin time for the extrinsic pathway. And if I say the person has probably the problem in factor 12, I believe, or factor 8, I believe that, and I want to check where is the pathway, is it working normally or not? Which test should I go for? APTT, activated partial thromboplastin time. So please don't forget that. APTT for intrinsic and PT for, right? This piece of information you will remember. It's very important for a doctor. Very important for a doctor. Okay? You don't need to memorize the steps of the pathway, but these things are very important. Which factors are heparin sensitive factors? You must know that. Which factors are vitamin K dependent factors? You must 1, 2, 3, 4. Tip of your tongue. You should be knowing all these factors. Yes.
All the factors are within the blood vessel, as you can have in the vitro.
In vitro. So even in the vitro, what do? You take the blood out, and all the clotting factors which are modules in the blood, they will work in the test tube. Okay? They will be active. But the tissue factor is not module. The tissue factor is outside.
So not just within the blood vessel.
All clotting factors are within the blood vessels. Okay? These factors which are working in the intrinsic pathway, you will find all the factors module in the blood which can initiate and which can work. Okay?
And this is the vitro.
In vitro also, you are taking the whole blood outside and you are putting that blood into test tube in vitro. That blood is taken from the body, from the blood vessel. Okay? So the same blood which is taken from the body, it contains the clotting factors, but inactive clotting factors. If you activate that factors outside the body, khalas, the pathway will work. Okay? Alright, boys. So in the phase 1, quickly, now we are trying to go quick and wrap it up. Okay? Phase 1 finished. The two pathways, they come to factor number 10, and after that you form the fibrin. That pathway, that part of the pathway is the common pathway. The result of common pathway is the formation of fibrin clot. Okay, isn't it? Thrombin is activated and thrombin converts fibrinogen into fibrin. Thrombin is a very, very special thing. It's a very powerful enzyme. It's a very powerful enzyme. Look at the functions of thrombin. Owl, the most important function in owl is actually it converts fibrinogen into fibrin. This is the main function. Okay, number 1. What is? It activates factor number 5 and factor number 8. Can you go back to the diagram? Can you go back to the picture? The pathway picture. Picture of one. Yes, this one. And look at that picture. Look at that picture. Do you see T?
Yes.
T. Thrombin, main function. Thrombin module here, right? Thrombin module here. Thrombin module here. So thrombin is also activating some thrombin. If it is formed, it will go back as a feedback, and it will activate more factor 8, more factor 5. Okay? So factor 8 activation, factor 5 activation, it is also done by the thrombin. So thrombin has multiple actions, many actions. Okay? Owl is definitely fibrinogen to fibrin. Okay? Did you get that? Did you see the role of the thrombin here? Okay. It also has a stimulatory effect on factor number 13. Maybe it's not shown in the diagram. Mungkin it is not there in the diagram. But is it there in the diagram? No. Okay. But it also has a reinforcing effect or factor 13 stimulating effect. Okay? Mind it, it's important. So, thrombin also has an effect, or it makes it more powerful conversion of prothrombin to thrombin. And once thrombin is formed, this thrombin goes back to the prothrombin, and it also pushes for more conversion in a feedback. It's positive feedback. It's going back. Okay? More. Once thrombin is formed, this thrombin will act on prothrombin, and it will form more thrombin. Okay? So more activation of the prothrombin. This is also an action. And it also activates the platelets so that the platelets can stick and they can form, they can come more, and they can form a stronger plug also. Okay? So then, even 4 or 5 actions are very important for the thrombin. But if you want to remember, if you forget about the other actions, and if you want to remember Wahid action of the thrombin, then it should be, yes, at least don't forget this action. This is the last action to be remembered. It's the most important. Getting my point? Any problem in thrombin? It's easy. It's fibrin threads. You are forming the fibrinogen molecules to fibrin like this, and these threads are formed. Okay? And now they will attach to each other like this, and they will form a network. The threads will elongate, they will become tawil. Okay? This is one molecule if it is there. Then this molecule will fix with this molecule, and one molecule will fix here, and they will form like a net. Okay? What do you call net in Arabic? By which you catch fish. Fishing net. Okay, just like a fishing net, this net is formed. Okay, you have seen the fishing net, and you can see the knots are there also. So at that point where the knots are there, they are tied. That point is the fibrin stabilizing factor. In the fibrin stabilizing factor is attaching the 2 points of the net here, 2 threads here, like this. Okay, these are the covalent bonds which are formed by the fibrin stabilizing factor, and they lock it like this so that it becomes tight. You cannot break it. And just like when you go to the sea, and you throw the net inside, and then you take out, what do you get in that net? Only a spark or something else? Maybe jumri, maybe you will have other things, maybe you have some other creatures. No, it's a mixture of many things. So just like that, if that net is modued in the blood and the blood is passing, what will you catch in that? RBCs, you will catch white blood cells, you will catch platelets, you will trap some plasma also, because some moil is also modued in the net, isn't it? That's why plasma is also modued, and in the clot, you have everything like that. Okay? So it's kind of a net which is formed powerfully. Inside that net, you are trapping the RBCs, you are trapping the WBCs, you are having the platelets, you are having the plasma protein, you are having some amount of plasma also, and that's it, like this. Okay? So this is it. So this is a meshwork which is formed in which you can see the red blood cells and white blood cells are also modued, and the platelets are also modued inside, and these are the fibers of the fibrin. Okay? They are forming like a net. Okay? So when the fibrin factor 13 acts on that one, the soft loose clot becomes a strong clot or a hard clot. Okay, and it becomes very powerful. In vivo and in vitro coagulation, I think there is no need to do that. Mashallah, you have known it very well that if I say in vivo coagulation, you will talk about the extrinsic pathway, and it can involve intrinsic pathway also at the same time. Okay, but the main pathway is extrinsic one, you know that. Okay, and in vitro, only one pathway that we will talk about, and that's the intrinsic pathway. Okay, all right. Some connection between the two pathways, that the two pathways are working. Two pathways are working together inside the body. Do they share some characteristics? Do they help each other? Yes or no? Yes, they do help each other also. Okay, they have some. Factor 7. Is it from extrinsic pathway or intrinsic pathway? Yes. Extrinsic. But it is helping the formation of factor 10. Okay, 10 to 10A. That we know that. Okay, this is coming. Now look at 10A. When 10A is formed, 10A will result in the formation of thrombin. The thrombin is formed. This thrombin goes, and this thrombin initially activates the intrinsic pathway also. Remember, thrombin is also needed in the intrinsic pathway. Factor number 8 activation. Do you remember that? Alright. And 5A activation. 2 points where thrombin is also working. Factor number 8 of the intrinsic pathway. Remember that? Now, the Jadid concept, the Jadid studies say one more thing, that factor 7A also activates factor 9. It is not shown in the diagram. It is not shown in the diagram, but Jadid research is telling us that 7A, once it is formed in extrinsic pathway, it is also active on the factor number 9 and converts 9 into active. Okay? It's working on 8. Yes. It's working on 5. Yes. It's working on 13. Okay. Yes, little amount. Is it working on 9 also? Yes. Jadid research is saying that it's also working on 9. Halas. So we accept it. This is a new concept. Alright? Okay. Now, new thrombin is formed, and this thrombin is activated. So, by forming the thrombin, you are involving the intrinsic pathway also. Once you form thrombin from the extrinsic pathway, which is the shorter pathway, now some thrombin will go, and it can also activate the intrinsic pathway. Alright? But remember one thing, the main pathway for all practical purposes inside the body working is taken as the extrinsic pathway. Okay? We agree on that. Khalas. This is only a Jadid research, which is we are adding in our discussion, and that's it. Shabab, please. This is something that we all need to know really carefully, and these are the physiological mechanisms. Please have a closer look here, and there is a table, and this table is giving us some. There are 3 columns in the table. Number 1, inhibitor. Number 2, hadaf or target, and what is the final function or effect which is happening. Okay? Alright. Now, these are the mechanisms which limit clot formation. Shabab, clotting is good for the body. There is faida always because it stops the blood. It is hemostasis. But if you don't check this process or if you don't control this process, what will happen? The clotting will go and the whole blood will be clotted. Do you want that? No. So it means you have to have a check. You have to have a control on this process also. You are allowing clotting. It is good for the body. It is needed. It is ruly. Okay. But you have to see that, okay, now for us it's over. It's more than enough. You have to stop it. You have to control it. You can't let it go unlimited or continuously. Okay? For that, you need some special mechanisms in the body which can control the process of clotting. Once the clotting is alhamdulillah done, you have to control this process. Otherwise, it will cause a disaster. It will cause a big problem. Look at that. There is an inhibitor which is called tissue factor inhibitor. Okay? Tissue factor pathway inhibitor. Alright? You know, tissue factor is activated. You have to control that also. Its target, the target of the tissue factor is that it will bind with factor number 7 and tissue factor complex. Remember that complex is formed in the extrinsic pathway. This complex will convert factor 10 to factor 10A. So once it has done the job, once the shovel is over, it's finished, you have to stop this complex. So this tissue factor will go and will control. Okay? So it has to control this factor complex. You got my point? And it, in this way, it has the negative feedback effect on which pathway? Extrinsic pathway. Alright? Which is the main pathway of working. Alright. So this is very important to control the situation. Antithrombin. The name is telling you, antithrombin yani, it should stop thrombin. Okay? Thrombin, I told you, is a very active, very powerful, very strong enzyme. You cannot leave thrombin. It will destroy, it will cause clotting and clotting and clotting. So you have to control the thrombin also. For the control of thrombin, you have got a substance called antithrombin. Okay? And that antithrombin, it is antithrombin 3. It is coming from liver. It's a protein. Okay? It is module. So this antithrombin, shabab, antithrombin is an anticoagulant or it is controlling the thrombin. But alone, it doesn't work. It is very weak. It needs a partner. It needs a teamwork. You know, it needs another thing. If the two are module, they become 100 times more powerful. Okay? Now look, antithrombin 3 will combine with heparin. Okay? And once these two combine together and make a complex, antithrombin, heparin, cofactor, when they two combine, they becomes 100 times more powerful. Without heparin, it is only one-time activity. With heparin, when it attaches with heparin, it becomes more than 100 times powerful and it becomes a very strong antithrombin complex. Okay? So, inside the tissues, inside the blood, antithrombin 3 will combine with heparin and this complex will control. Okay? Heparin is coming from our tissues. Heparin is secreted by our tissues. Little amount of heparin is module naturally, which is good. Alhamdulillah. This heparin is coming from the mast cells and this heparin is coming from the basophils. Mast cells and the basophils. So heparin will join with the antithrombin 3. They become very powerful. They become very good. And they control the situation. Okay? So, after when they combine with each other, and these two combine with each other, I will ask you, heparin. Which factors were sensitive to heparin? My question from you.
9, 10, 11, 12,
Active forms of its module, red color, remember? Hammer alone in your picture, yes. So the factors are 9, 10, 11, 12, 4 and thrombin 2, okay? Khamsa, okay? So there are khamsa ahdaf. 1, 2, 3, 4, 5. 5 things. When there is a complex formation in antithrombin and aberrant command, they become 100 times more powerful. And now they will attack how many things? 5 things. Okay? And they will control these factors so that the clotting cannot go. Okay? This is the beauty of the process. So these two are working together. Okay? You can see it here. It's maktub here. There are some proteins, little proteins, which are secreted in the blood and they come from the liver. Protein C and protein S. Okay? They are also anticoagulants. Their target, their hadaf is factor 5 and factor 8, and they inhibit these factors. Okay? The formation of factor 10A and thrombin by inactivating. So mainly working on intrinsic pathway or extrinsic pathway? Intrinsic? This mean 8 is from
Extrinsic.
Where is 5? After common pathway, right? That is in the common pathway, not in the extrinsic or intrinsic, but this one is from intrinsic and this one is from the common pathway, right? Remember, very good. Thank you. There is one protein which is called thrombomodulin. Okay? It is endothelial protein. It is modular in the endothelium. Okay? Where? The endothelium of the blood vessel. And that binds to the thrombin. When zyada thrombin is formed, it will catch and it will hold thrombin so that the process of clotting cannot go very long or for a long time. Okay? So thrombomodulin, plasmin, fibrin. Plasmin is one more special protein and that will act on fibrin and that will, it's like a Caesar. Okay? Now fibrin is long. Okay? You cut, tuck like this and you will break the fibrin into small parts, small pieces. And this is the job of plasma. Plasma is like a Caesar cutting, tuck, like this. You are cutting the neck like this. This is plasma. Okay? Is this chart clear? Any problem in this one? These are important, Shabab. These are the special mechanisms to control the clotting. Okay? Please do it carefully. Please do it carefully. Okay? It's important. Alright. Now, the last thing is that finally when the clot is formed, do you think this clot will remain abadan, gone for long or for forever? No. It has to disappear. Once the blood vessel is repaired, once everything is gone, this clot has to dissolve. This clot has to disintegrate. This clot has to become smaller. This clot has to become fibrotic. This clot has to disappear as much as possible from the blood vessel so that everything becomes normal. Okay? There is a system of controlling the clot. Okay, we done it. There is a system of breaking the clot, dissolving the clot, or bringing everything back to normal. And this system is called the fibrinolytic system. Okay? And this system has two things: fibrinolysis. First of all, you will cut the clot and dissolve the clot, and you will repair the damage of the area also. Again, the blood vessel wall was damaged, so you have to repair that also. So, alhamdulillah, this is the last step of the fibrinolytic system. It is not the part of clotting. Clotting is khalas. Clotting is done. Now, controlling its homeostasis. Now you are bringing everything back to normal. You are bringing back to life. You cannot leave the clot in that area. Okay? So, basic concept. There is a special protein called plasminogen, which is modular in the system. It is a new protein. Alright? Its gen, inactive. Definitely it will be converted into the active form, and the active form is known as plasmin. Remove this gen and you will become plasmin. Okay? In the fibrinolytic system, there is a special substance coming from the tissues, and that substance, tissue secrete that substance. It is called tissue plasminogen activator. Do you see that? P, plasminogen activator. If this substance is released, okay, the clot is formed. If this substance is released now from the tissues for removing it, plasminogen is converted into plasma. Okay? Khalas. What will plasmin do? Plasmin, I told you, is like a Caesar, and that will cut the fibrin into. Now you have a fish net in which everything is modular. Now you take a Caesar, and this Caesar is what? Plasmin.
Plasmin.
You say, okay, I'm going to tuck, 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 tuck. From every point you cut it, and you leave it like this. And now you see what will happen. Now the blood is flowing, and the net is cut from everything. So what will happen? Some amount of red blood cells, damaged RBCs, WBCs, they will start moving with the blood. The pieces of the fibrin will move with blood. And this area where the clot was modular, it will become smaller in size and smaller in size. And after some time, after a few days, Takriban, major amount is taken away. Alright? So this clot is now, but not on the same day, not in 1 or 2 days. After some days, once the process of regeneration has started, once the repair is done, that clot is slowly removed. Okay? This is the process. Alright. Okay. So, plasminogen is converted into plasmin. Who is converting it? Tissue plasminogen activator. Where is it coming from? The tissues. Okay. Now, if plasmin is formed, if zyada plasmin is formed, what is the khatar? What is the danger? Yeah, the clot is formed, and if more plasmin is formed at that point, the clot is quickly removed. So what will be the danger? Bleeding. Again bleeding will start. That's the problem. So it means you also have to control plasmin, isn't it? For everything we have, alhamdulillah, we have a control. So controlling the plasmin activity, we have another substance module, and it's called alpha-2 antiplasmin. So if plasmin is working, there is a substance which is checking the activity of the plasmin. If plasmin is working more, well, it will handle it, okay, grab it, and it will kill the plasmin. So alhamdulillah, you have an activating substance, and you have finally an inhibiting substance which is controlling the plasmin also. Okay? Alright. The same thing, the same. Did you get the concept, basic idea?
Yes.
What is the fibrin degradation process?
Yes. After when I cut the fibrin threads, the clot, tuck, 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 okay? The pieces of the fibrin threads, this piece, this piece, this piece, this piece, these pieces are released into the blood. The cut portions of the fibrin threads, small pieces of the fibrin threads, they are released into the blood. And these are called FDP, yani fibrin degradation products. They are modules in the blood. So after clotting, after some time of the clotting, FDPs are modules in the blood. Yes or no? Yes. They are not. Okay? Same thing now, but in a beautiful diagram. Look at that, Shema. Look at that. So I will see this diagram with you. Let's have a look. Same thing. You are inside the blood vessel. Can you see that? And the clot is formed. You can see the clot modules in the blood vessel. Clot is good, but after some time you don't want the clot. You want the clot to remove, to get smaller and smaller, because the job is done. So now, from the blood vessel epithelium, there is a factor released which is called TPA. Remember what is TPA? Tissue plasminogen activator. Okay. This tissue plasmin activator, first of all, okay, when it is released, look at that, alhamdulillah, there is a controller of the TPA also, which controls the TPA also. That zyada TPA is not module. You have to control that also. What is that substance? PAI. PAI is inhibiting it or attaching it. So, tissue plasminogen activator is doing a normal job. What is it doing? It is converting plasminogen into halas, easy, plasmin. Plasmin is the main thing. Plasmin is the cutting Caesar. It will cut like this clot, fibrin threads. And once the fibrin threads are clot, can you see the fibrin threads form special products called FDPs? Can you see? Yes. FDPs are the small portions of the clot in which fibrin threads are modules, and they are released into the bloodstream. Okay. But you also know that we don't want excess catheph amount of plasmin also. We have to control the plasmin situation also. So what do we have for controlling the plasmin? Can you see the plasmin inhibitor? After plasmin has done the job, the extra plasmin is controlled by the plasmin inhibitor. And that's the whole process. That's the beauty of the situation. Every process is a controlled process. Okay? So alhamdulillah, for everything, every substance, do you see there is a check, there is a control module in our system. So that it cannot go in this direction and it cannot go in this direction. It has to be controlled. You got the point? Everything clear? We are done, alhamdulillah. Don't worry about that. This is the whole end of the story and we are done with it. Repair means now the blood vessel wall was injured. Now you have to repair the tissue, collagen fibers, and you have to form the fibroblasts will secrete the collagen, and endothelial cells will grow again, and alhamdulillah, everything will come back to normal. It is the process of the body that it will repair itself also. Okay? So just remember that repair happens once. That's it. This is the khulasa of the whole story. I am not doing this khulasa to you. You just see all the processes, how clotting is happening, and how the fibrinolytic system is also working and controlling the clot also. Everything is given here. This is the fibrinolytic system which is working here, and this is telling you about the different pathways. Here the intrinsic pathway is coming, here the extrinsic pathway is coming. Here are some factors which are the physiological inhibitors which are inhibiting it. So everything in this diagram is module which you have done in the previous slides. Okay? Yes?
Sir, what is the fate of the fibrin split? Will they get reabsorbed?
Fate of
Fibrin split.
fibrin.
Yes.
Yes. Look, fibrin is coming from fibrinogen. Fibrinogen is a protein. Protein is made up of amino acids. So fibrin degradation products are further broken down into amino acids and they are reused in the body. Khalas. Job of the platelets. Platelets have many functions in the clotting. Platelets are releasing platelet factor 3. Okay? And that factor is an important factor. Alright? Platelets are helping in the conversion of growth hormone to thrombin. Platelets are providing the surface, and all this clotting process is happening on the surface of the platelets. Our platelets are module, and all this process is not going on this side. If here platelets are module and forming the blood, the clotting is happening here. The clotting is not happening here. Over the platelets, between the platelets. So platelets are providing the support for all the process of clotting. Okay? Alright. Factor 13 is also coming. Some clotting factors are also coming from platelets. Little amount is released from platelets also. Okay? Alright. And finally, Shabab, one very important thing, one concept that you will remember it. Once the clot is formed in one area, for example, the blood vessel is damaged, there is a gap in the blood vessel. Okay? And here the clot is formed. Okay? Just imagine. The clot is formed here. So now there is a gap in the blood vessel because it is damaged. But clot is module and clot is closing. This is the clot which is module. Okay? Now after some time, after 1 hour takriban, sa unus saatain takriban. In that time, the clot retracts, shrinks and becomes smaller in size. After 1 hour takriban or after 1.5 hours, the clot which is formed, it becomes shrunken, it shrinks, and it contracts like this. You are squeezing it. If clot is attached here, in this area, okay, and this is the size of, this is the hajam of the clot here, in this area, and if it shrinks and it becomes takriban nus of its original size, asl size, what will happen to the blood vessel wall? It will come closer, really. Look at the gap. Our the gap was this much. After the gap mungkin becomes this much really. Okay? This gap can be filled very easily. So it is bringing the edges of the blood vessel closer. Okay? This is called clot retraction. This is the property of the clot. It retracts. It contracts because there are some proteins module here. Okay? Actin, myosin, and some microtubules and calcium, they are module in the platelets. And the platelets change their shape. So they are pulling inside the clot, and the clot becomes smaller in size, and it brings the edges of the vessel very close, and now it is very easy to fill that gap. Awal it was difficult because the gap was big. Now it will become this much mumkin, or a little less. Alhamdulillah. This is the benefit of the clot. You will do inshallah these factors, factor number 8 and factor number 9 in hemophilia. I told you, if genetically factor number 8 is not mawjood, it is the classical hemophilia, you call it hemophilia A, the main hemophilia. Inshallah tomorrow or day after we will study that. Okay? There is another disease, if factor 9 is not mawjood. Okay? It is also hemophilia, but now you call it hemophilia B. What do you call it? Hemophilia B. And there is another name of the disease called the Christmas disease. Why are you calling it Christmas disease? Because after the name of the first patient. So this disease is Christmas disease. This is what you need to know. This part is only for two types of heparin. Heparin is mawjood in the body. Okay? There are two types of cells which are secreting heparin in the body. Basophils and mast cells. Mainly our mast cells and little amount coming from the liver. Okay? This is our own heparin. Okay? Our body is producing this heparin. And what is this heparin doing? Is it helping us? Yes. It is combining with one special substance, anti-3, and it is making it 100 times more, 100 or 150 times more powerful. Remember? Okay? This is endogenous heparin, and both these antithrombin heparin cofactor will have 5 actions you gave me. Okay? Factor number 12, 9, and this, and factor 13, all the seriously, right? So it will control these activities. What is the function of exogenous heparin? Exogenous means you are giving it from outside. Heparin is now, you know that, it's anticoagulant. If you give it into the blood, it will combine with antithrombin 3 and then it will do the job. Why are you giving it from outside? Because in your patient there is a danger of thrombosis or extra clotting. Okay, so in either you are treating or you are preventing. Prevention and treatment of thrombotic conditions. There are multiple thrombotic conditions, okay, which can happen. I think you are familiar with this word, deep venous thrombosis in our veins here, in the legs usually. Sometimes, if the patients are there, shalal, operations, other patients who cannot come out of the bed, and they are lying on the bed for months and months and months and weeks. Their muscles are not moving. Thrombosis can happen in their legs. Okay? So, if you want to prevent the deep venous thrombosis, heparin is given, or for the treatment also of the deep venous thrombosis, we are using, okay, heparin. Pulmonary embolism, the same thing. From the deep venous thrombosis or from some area, an embolus is broken, and this embolus is going, and now it's going into the lungs. Now tanaffus is affected. Okay? For controlling, for dissolving that, for controlling that, we also give heparin from outside. Atrial fibrillation, you have not done cardiovascular system. There is a condition of, you know, the atrium and ventricles are mawjood in the heart. If the atrium is pumping or it's working on a very high speed, there is taqriban 220 or 300 times in 1 minute. Like this is the speed of atrium working. This beating, this is called atrial fibrillation. Very high speed of that. In that speed, there is a chance of thrombosis inside there. Okay? And we also use heparin for that purpose. Okay? Heparin is also given when we have some heart procedures, for heart operations, and for angiography, when we are checking the heart in angiography in different situations. We give the heparin from outside. And in dialysis for the kidney patients also. Okay? We add heparin so that the blood should not clot. Extra clotting should not happen in the blood. These are the advantages of the exogenous heparin. But our own heparin is very good. It is helping our own situation in our own condition. Thank you so much for being with me. It was a long lecture, but I am really thankful to you for hearing and for staying here. Do you have any problem here in this one? Done? All of you? Read it carefully. If you have any problem, just get in touch. contact me.
I'll answer your question.
Thank you so much and take care. See you inshallah.